Hey, this is Dr. Murchie from Dentistry. Hope you're doing well. I want to talk to you a little bit about some of the coolest pieces of technology that we have. Makes a huge difference for you. It's called a curing light. We'll find out some more information about that here in just a second. What is a curing light? Curing lights use blue light energy to cure or set up fillings and cement. I would estimate that we use a curing light 24 to 40 times a day. If it weren't for curing lights, there would be no tooth-colored fillings in dentistry, and all the fillings would be dark silver fillings. There's a bunch of different curing lights. Some are very fast, they can cure in 3 seconds. Some are slower, can cure in 10 or more seconds. Some are powerful, they send light deep into the filling. And some are both fast and powerful. So this is, in my opinion, the most powerful and beautiful curing light on the market. So it's very fast, cures in 3 seconds, tremendous amount of power. This is another version. I want an earlier model of a different brand, but I want to show you the difference between the two. Here we go. Watch it how much less power comes out of this lower curing light and how much longer it takes. Another about 10 seconds. So, what are these used for? We make fillings. This is a filling material. Comes in these little tubes. Fillings, after we've removed cavity, they come out in these little raindrop tear things. And it's a very putty-like material, so we can adapt it and shape it into various different things. And what I'm going to try to do right here is I'm going to try to make a tooth. And this is going to be a rough tooth, but it's going to be the best I can do on a video here. So you got that. Then I'm going to add a slightly different color here. So when I make a filling, I will sculpt the tooth, kind of like what I'm doing right here, and make it adapt to where the tooth is. Put a little bit of anatomy in this tooth to make it look a little bit more like a tooth. There you've got the roots of this tooth, and this would be a molar tooth, but that's what the tooth looks like. So what happens is, you saw I could sculpt and everything there. What we do now, I'm going to shine this curing light on here. And as I'm curing this, the blue light goes and makes the filling material become hard. So now when I pick this up, it's hard and it does not move, and it fits very easily. So that's what we use them for. Now the other thing that's advantage about this for you, especially as a patient, is this fast curing light is the angle at which the light comes out. This one is straight and it's a very narrow tip, whereas this one has a curve on it. So this is a model of a child's mouth. If I were to do a filling on the farthest back tooth, you can see how I don't have to really have the child open very wide. You can cure right there. And that's pretty comfortable. Whereas if I have to use this other curing light, I have to have you open your mouth much wider, and that's a much bigger distance to cure. And it's just more uncomfortable when you're having to wait for that. And you add the 10 seconds, it's not as much fun. So we're using technology to make your visits at the dentist as comfortable as they can be, and to make them a pleasure for you and your family. Thank you.